Hello everyone. So today I'm going to talk about diabetes and how gender plays a role in the development of diabetes. So you may have a friend or a colleague that has type 2 diabetes. They may present symptoms like fatigue or frequent urination, hunger, and thirst. Or they have blurry vision, or also they may have some pain or the numbness in their foot and hands. So these are the symptoms of type 2 diabetes, and it's caused by the very high blood sugar levels. So how does type 2 diabetes develops? Let me explain. So after the meal, our body will turn carbohydrates. So these includes the everyday food we eat, the bread, spaghettis, rice, or potatoes over here. So our body will turn this carbohydrates into glucose in the blood. The glucose is the scientific term for blood sugar. So our pancreas will produce the enzymes that digest the food we eat. But it also has those lovely beta cells, which are the superstar of my talk today, and they produce the famous insulin. So insulin is like a key that opens the doors of the cells. So to move the sugar efficiently from the bloodstream into the cells to be used as energy, and the energy will sustain our everyday living. However, during type 2 diabetes, which usually develop during adulthood, our beta cells no longer produce insulin anymore. And at the initial stage of type 2 diabetes, we still have insulin in our body. However, another problem is that our body is not reacting to insulin anymore. Like we said earlier, like our cells cannot use the sugar to make the energy. And that's why we feel fatigue. And also, in this case, we have excess sugar floating in our blood. And that's why we hear that diabetic patients have very high blood sugar level. So now I'm going to talk about my research that is associated with all of you ladies and gentlemen. It's about sex hormones that are the male sex hormone testosterone and the female sex hormone estrogen. So they have a huge effect on the beta cell's function, in particular its ability to produce insulin. So as a result, it is involved in the development of diabetes, and we want to explore them as a therapeutic strategy for treatment of diabetes. So before the age of 50, that is usually before menopause happens in women, women compared to men are less likely to get type 2 diabetes. The difference lies into the very fact that women have a higher estrogen level. So estrogen, our research suggests that not only have a very beneficial effect on the health of the beta cells, but also it will help the beta cells to produce more insulin. However, during menopause, which is a natural process happening in women, the estrogen level goes down. As a result, the protection of the estrogen on our beta cells is also gone, and the risk to develop type 2 diabetes in women rises. So in men, the equivalent male sex hormone is testosterone. And my research also suggests that testosterone will boost the beta cells to produce more insulin. However, you might know that men do not have menopause. So in normal men, the testosterone level is relatively stable throughout their adulthood. However, in some middle-aged or older men with low testosterone level, or some prostate cancer patients receiving a therapy that blocks their access to testosterone, they have a higher risk to develop type 2 diabetes as a result of a lack of protection by testosterone. However, you might also know that we cannot directly introduce estrogen to women or testosterone to men because of increased cancer risk. For example, the breast or uterus cancer in women or the prostate cancer in men. So currently, I'm conducting research to develop a targeting drug that will deliver beneficial factors like estrogen or testosterone to women or men's beta cells specifically. So how does this work? So we can consider this targeting approach as a key. So the key can open only the doors of certain type of cells. So in this case, it's the beta cells. So we attach the beneficial factors like testosterone or estrogen to our key. So it delivers specifically those beneficial factors to our beta cells to make them healthier, happier, and produce more insulin. So hopefully one day it will lead to therapies that cure diabetes. So that's my hope, and I'm quite positive person and hope one day I will achieve this. Thank you very much.
Thank you, Weiwei. It was really, really cool. It's very interesting how sex hormones can make a distinction or influence on how we react to diseases and how we react to the treatments of those same diseases. Mm-hmm. It's definitely something that we should consider for the future of medicine. Mm-hmm. In relation to the influence of sex in the treatments, and the fact that there are many studies that are actually done with male subjects in clinical trials, Hassan in Facebook would like to know if there are any strategies that we have in place to prevent this male bias or to deal with this male bias. Mm-hmm.
So I think there's a historical reason why we choose males, especially for basic research. It's like for females, we have the menstrual cycle. So for that, it's another variable to consider. That's why historically people use male animals, or like for clinical trials, it's more males than women. So as I posted before, it's like a lot of clinical trials were done in males, so that create a bias. So now currently the research world has recognized this problem. So back in the US, I was very aware of the issue back in the US. It's like for the National Institute of Health of the United States. So they strongly suggest that to take this gender as a variable when conducting research, not only the basic research, but the clinical trials. So that we can see the bigger picture. Is like male, female, they are essentially different. So there will be essentially different results. And I think this is like a big advancement, I would think. And also we need to promote this. We have to consider this variable in designing our research.
Also, coming back to the, you talked about the estrogen and the effect of estrogen in females and how we should give them estrogen. Celia in Facebook actually asked us if does birth control influence diabetes? Okay,
so for birth control, so usually it's a combination of estrogen and progesterone. So in a sense, it's like it creates a constant or a stable estrogen level. So if there's estrogen level is stable, there's no spike in estrogen level, so there's no ovulation. So so usually the idea of it is to create a stable estrogen level. So there's no huge peak in the estrogen level, or it's not enough estrogen. So in that sense, I think our bodies still have a stable level of estrogen. So that won't affect like diabetes development. So it's more like when woman enter menopause, which is around 50, your estrogen level goes down dramatically. So that will lead to a huge increase of the diabetes development. So in essence, I think it is more risk there. But birth controls, there's other problems of birth controls. So if it's very high estrogen level, it may lead to breast or endometrial cancer. So, but like in the diabetes perspective, I think it's quite safe.
Another interesting question that we have on YouTube from Mart. How can you make sure that the drug that you are creating will be specifically delivered to the beta cells?
Okay, yeah, that's like what I talked about in the last. For example, this is my beta cells. So it has like very special features on the beta cells. So it's like the key that I talked about. So we wanted a key to open the door of the certain type of the cells, like our liver cells, or not our like breast or uterus or prostate cells. So like you only have one key that you own to your own door, right? So in a sense, like we wanted to find a key that's specific to the cells of our interest, which is the beta cells. So to open the doors of our beta cells to only give the drug to the cells specifically.
Because you described two types of diabetes, 1 and 2, and for now you are basically talking about the type 2 diabetes. We do have some questions on Facebook about the type 1. So in type 1 diabetes, do they also get worse with menopause like in type 2? This was a question from Mar in Facebook.
Okay, so because of the time limit, I cannot talk about type 1 diabetes, but for type 1 diabetes, so our beta cells do not produce insulin anymore. So, but this type of diabetes usually happens in small children or adolescents. So, in that sense, there's like less of a hormonal issue on it. But during menopause, it may affect this population as well. But in the beginning, but for this population, you can always use insulin as a treatment strategy. But we also find that using estrogen actually is also saving the remaining beta cells of the type 1 diabetic patients. Because usually they are under attack and then they die, they cannot produce insulin. But there's some remaining beta cells that can be rescued by estrogen. So I think our research can actually help the type 1 diabetes patients
as well.
Also.
Really interesting. Still in the topic of the menopause, Irina in YouTube asks if when you have a hormonal therapy for menopause, if this could affect or increase your risks of diabetes or alter somehow your treatment options. Okay,
so during menopause, like women usually receive estrogen replacement therapy. So in essence, a lot of research suggests that this therapy is helping with the diabetes situation. So, but this therapy has also its problems because of the future cancer risks. So there's like a woman initiative. It's like a huge trial trying to look at the effect of estrogen replacement therapy. So in essence, you have to get it at certain time point in your life when you first entering menopause. So you get the treatment because your estrogen level will get from the normal level to very low or 0 level very quickly. So in essence, there's like a very short time window that you can apply the therapy. So if it's applied, it's actually very beneficial for your cardiovascular system, like your blood vessels, your heart, as well as helping with the diabetes development. Awesome.
Coming back again to the treatment. So Celia in YouTube asks if you will administer estrogen as a treatment for diabetes in all genders.
I think men would not like to get estrogen. So in essence, it's like I'm saying that estrogen is really beneficial for women and it's also for men. But the thing is, men do not want estrogen in them. So the good thing is testosterone. But normally men will have normal testosterone level. But it's just for particular category of like prostate cancer patients or like the people, older men, like with low testosterone level. So the testosterone is actually doing relatively the same thing as the estrogen in men to protect the beta cells. So there's like an estrogen replacement therapy for the prostate cancer patients as well because they're increased diabetes risk. You can treat them with testosterone. But we wanted to link this testosterone to a specific targeting approach so that it just goes to the beta cells, not to the prostate, so that it can help them.
That is really interesting. So then your treatment, your idea is that you will put the hormones in, but then the hormones will not affect the entire body, but just the specific
the beta
cells
of the interest to produce more insulin.
Can you give us just a little bit of a clue? How exactly can you do this? Like how do you create these keys?
I have to like, in a sense, go into a more of a technical terms. So there's like a receptor, which is like a lock. on the cell surface. So in essence, like we find the certain lock to receive our key. So that's but not every door has the same lock, right? Like one lock is to like one door. So in essence, we want to find the lock and then try to see which key will fit into our lock, and then attach our therapeutic strategies to this key, so that to open the doors of our beta cells, to give them the therapy, and to make them happier.
Thank you so much, Weiwei. And thank you to all of you that have posted your questions. If you have any more questions, you can ask Weiwei on our Twitter page, which we will post in the chat.